Hey everybody! Today I'd like to talk about a really important issue. I'm sure many of you have already heard about the increase in opioid abuse as well as opioid overdoses, and since we work in healthcare, many of our patients are prescribed opioids, and we see a lot of people that have overdosed. We help try and treat that. So today I kind of want to talk about something patients can do for pain relief that is not using opioids. This has been kind of an increasing problem, so it's better to go ahead and learn about it and figure a way to make a solution to it. The National Institute of Health stated that over 115 people in the U.S. die after overdosing on opioids. The abuse and addiction to opioids actually does include prescription pain relievers, but it also includes things like heroin and fentanyl. And the CDC states that the burden of prescription opioid misuse in the U.S. is $78.5 billion a year. So that's a lot of money in healthcare for that. And 21 to 29% of patients that are actually prescribed opioids for chronic pain misuse them. And 8 to 12% develop an opioid use disorder. So that's why it's so important, because a lot of times patients have questions about, are these really going to be addictive or not? They're prescribed them, so they expect them not to be addictive many times. So we need to be honest with them about that. And this issue has become a public health issue. There is a rise in neonatal abstinence syndrome when pregnant women are using opioids during pregnancy. There's also an increase in infectious diseases such as HIV and hepatitis C, and that's a lot of times from people using dirty needles and from the IV drug use. So that's a big concern. Because that puts the general population at risk, and then it also puts our doctors or nurses and anyone who comes into contact to care for that patient like that at risk of getting some of these things. So we just have to be careful about that. So the top 5 counties in Kentucky for deaths per capita because of opioid overdose are Kenton, Campbell, Boyd, Mason, and actually Jessamine. And that article was actually written into July of 2018, so a couple months ago. And at that time, Jessamine County had 8 overdose deaths, but this is probably misleading because many of them are taken to UK and they later died there, so they actually die in Fayette County instead of Jessamine. So one important thing about this is that with so many people overdosing, it really does affect our healthcare system. I mean, in time, money, and resources that we spend on treating the overdose. And it exposes other people to infectious diseases if these individuals have contracted any. So what I chose for a method of pain control that was not using opioids and was not pharmacological was acupuncture. I chose acupuncture as an alternative to opioid pain management because it's something many individuals are sort of familiar with. They've probably heard about it, so they know a little about it. They may have already had some interest in it. They also might know a family member or friend that's using it. It also has a low risk of injury when it's performed by a trained practitioner. And a reason that I thought was really cool too is that it's approved to be safe in the use of acupuncture for pregnant women, so that's awesome. However, for my patient population, I felt this would be a good alternative because many of them have spinal cord injuries or have had surgeries on their spinal cord, and they have a lot of chronic pain. And the thing about that is many of these patients that are paralyzed or have these serious injuries to their spinal cord, they lack sensation depending on where the incision was, depending on where the injury was. So if they were to have a fear of needles used in acupuncture, that could be alleviated because they wouldn't be able to feel possibly at some of those pressure points. In regards to culture, my patient population is very diverse. We get a lot of different cultures in, and that would just have to be something discussed on an individual basis with patients, considering acupuncture or not considering it at all, because there's different cultures, so many different cultures coming through. So to make sure it was appropriate, it would have to have a discussion with the patient about it. Next, I would like to explain my teaching plan to you. So I have talked a little bit about my audience, but I'd like to go a little more in detail with you about them. I want to present the material to patients in an outpatient rehab clinic, an outpatient rehab pain clinic. Many of these patients are already on narcotics for pain management because of the severity of their injuries and severity of the surgeries they've had on their spinal cord. And they get a lot of chronic back pain. Often you see that. And I'd like to find non-pharmacological methods of pain relief for their chronic pain to give them some relief. By the end of the presentation, I would really like the patient and the family, if they're present, to identify a possible new alternative for their chronic back pain. I have certain learning goals I would like for them to achieve. Patient being able to list 4 benefits of acupuncture for their pain and 1 reason why they should consider it. I'd also like them to identify appropriate locations for safe and professional acupuncture treatment by the end of the presentation. I'd like them to be able to share 2 possible barriers to using acupuncture for their pain management, and accepting the information of a practitioner that practices acupuncture and my written material. I'd like them to be able to schedule a consultation with their physician about starting acupuncture treatment for their pain by the end of next week, if it's something that they're interested in. Also, being able to use the internet to research safe practitioners practicing acupuncture in their area. Some of our patients do travel to us. So since I've got these goals for my patients to learn, I also have to have a way to evaluate them. So learning has occurred if my patient can list 3 benefits of acupuncture and appropriate locations to receive those services. Also, if they're able to share possible constraints to receiving acupuncture and accept my written materials. If they're wanting to do it and they schedule a consultation or they research safe practitioners available in their area, then learning has occurred for them there too. So now I'd actually like to go over my handout to my patients. So acupuncture can provide pain relief for a lot of different issues such as low back pain, migraines, osteoarthritis, fibromyalgia, anxiety, sprains, and it's been safely evaluated for use in pregnant women. Many of our patients have had spinal cord injuries for years, and they've been managing them, but they also have comorbidities such as osteoarthritis. I've seen that a lot, so this would be good for both of their issues. So we're going to talk about what acupuncture actually is. It's insertion and manipulation of needles at specified points in the body, but it's also not just inserting needles. It can also be the application of heat or the application of pressure. And it works best when used with a recommended diet and exercise programs that were suggested by your doctor. So that's important to remember. Some more important information is treatment results vary, so it may relieve your pain for longer or shorter than another individual. That may need to be repeated more often. Definitely consult your doctor before you try acupuncture. And there's a low risk of injury when it is performed by a trained practitioner, so that's a positive thing. And it should not replace your medical care. It should be used as a supplement to enhance it and help with pain relief. I'll provide one of these attached with this video so you can look at it. Thank you all for your time today.